You are the last person standing between someone and death. Every single shift, no exceptions. You are 22 when you decide, not because medicine looks glamorous, because you watched your grandfather die in a waiting room. The doctors were busy. Nobody came for 40 minutes. You stood there holding his hand. You promised yourself you would never let that happen to someone else. That promise will cost you more than you know. Medical school starts in the fall, 4 years, then residency, then emergency medicine fellowship. You are looking at 11 years before you work unsupervised, 11 years of training to make decisions in seconds. The math never quite makes sense. You do it anyway. The first 2 years of medical school are books, thousands of pages, hundreds of conditions, symptoms that look identical but mean completely different things. You study 16 hours a day. You forget what weekends feel like. Your friends graduate and get jobs and buy cars. You study. You tell yourself it is worth it. Some days you believe it. Year 3, you enter the hospital for the first time as a student. Everything they taught you in books becomes real. The smells are different from what you expected. The sounds are different. The patients are different. They are not case studies. They are people, frightened people, and they look at you like you have answers. You are 25 years old with a stethoscope and a laminated badge. You do not always have answers. You learn to look like you do. Your first patient dies during your 3rd week. Cardiac arrest, 61 years old. You do everything correctly. It doesn't matter. He dies anyway. Your attending physician tells you that this will happen again. Many times. He tells you the goal is not to never lose a patient. The goal is to never lose a patient because of something you did wrong. That distinction keeps you functioning. It does not make it easier. Residency begins at 26. Emergency medicine residency, 3 to 4 years, shifts of 12 to 16 hours, sometimes overnight, sometimes multiple nights in a row. Your salary is around $60,000 a year. For a 100-hour work week, you do not become a doctor for the money in the beginning. You become one despite the absence of it. The emergency room is unlike anything you trained for. Every patient is unknown. Every case arrives without warning. You see car accidents and overdoses and heart attacks and strokes in children who fell and elderly people who live alone and haven't been found for days, all in one shift, all requiring different decisions, all requiring those decisions immediately. You learn to prioritize without feeling, not because you stop caring, because caring too much in the moment gets people killed. The emotion comes later, always later. In the car, in the shower, at 3 in the morning when you cannot sleep. Year 2 of residency, a child comes in, 7 years old. She is not breathing. You work on her for 22 minutes. She lives. You walk out of the trauma bay and stand against the wall in the hallway and breathe. Nobody sees you. That is intentional. You do not cry in front of patients or colleagues. You learn to hold it somewhere you can access later. The storage fills up slowly. You don't notice until it is almost full. By year 3, you are faster, more confident, less surprised. You can read an EKG in 40 seconds. You can intubate in under a minute. You can have a family conversation about a terminal diagnosis in the middle of a busy shift without losing your composure. These are not skills you're born with. These are skills that cost something. Residency ends at 30. You are now an attending physician, emergency medicine. Your salary rises to $240,000 a year. You have earned every dollar of it in ways that do not appear on a pay stub. The job changes your relationship with time. You do not think about next year. You think about the next patient. You do not plan vacations far in advance because you have seen too many people who planned vacations they never took. You live in the present tense in a way most people never manage. This is one of the gifts the job gives you. It comes with conditions. Your relationships are difficult, not because you are a difficult person, because you are never fully present even when you are there. Part of your mind is always calculating, always scanning, always preparing for something to go wrong. The person across the dinner table from you deserves better than half of your attention. You try. You do not always succeed. At 34, you make a mistake, not a catastrophic one, a medication dosage, caught by a nurse before it reaches the patient. Nothing happens, but you spend 3 weeks unable to walk into a shift without your hands shaking slightly because you know what almost happened. And you know that in emergency medicine, almost is often the difference between a near miss and a tragedy. You talk to a colleague, it helps. You talk to a therapist, it helps more. You learn that asking for help is not weakness in this profession. It is survival. At 38, a colleague burns out completely, takes a leave of absence, does not come back. This happens more than the public knows. Emergency medicine has one of the highest burnout rates of any medical specialty. Over 60% of emergency physicians report significant symptoms. You recognize some of them in yourself. You make changes, fewer night shifts, more time outside the hospital. You take up running. Not because you enjoy running, because your body needs to go somewhere that isn't the emergency room. At 42, a patient recognizes you in a grocery store. She was brought in 3 years ago. Stroke. You don't remember her. You have seen thousands of patients. She remembers you. She tells you that her daughter got married last spring, that she danced at the wedding, that she almost didn't make it to any of it. You stand in the cereal aisle holding a box of oatmeal. She hugs you. You let her. You drive home and sit in your car for a while. Not because you are sad, because sometimes the job reminds you why you started, and those moments are rarer than the difficult ones, so you hold on to them. You work until 56, then you step back. Not retire completely, supervise, teach. Let the younger doctors make the fast decisions while you make sure they don't make the wrong ones. The transition is harder than you expected. The emergency room was loud and exhausting and never predictable. You miss it more than you thought you would. Someone asks you once if you would do it again. You think about your grandfather in the waiting room. You think about the 7-year-old who danced at her daughter's wedding. You think about 30 years of shifts, the ones you got right, the ones you almost didn't. Then you answer yes. Not because it was easy, because nothing worth doing ever is. And some promises are worth the cost.